Hi there, welcome to our second segment of Coffee and Colleagues. I'm Dr. Anna Gretchik, naturopathic doctor.
My name is Brianna Urquhart. I'm a registered social worker.
And my name is Richard Pikacek-Vaca, and I'm a registered psychotherapist qualifying. So, this is the first time I've been on one of these things.
Yes.
I've never been on YouTube.
Welcome to the table.
Yeah, thank you very much, right? Like, I got the smallest coffee here. I know one thing that really comes up a lot, when it comes to, say, discussing, with colleagues, and sometimes this comes up with clients as well, is the difference between, regulated, unregulated, people who are part of, like, say, associations and things like that. So we wanted to talk a lot about was the importance of having a regulated healthcare practitioner versus, say, somebody who's not regulated, or somebody who may be, say, part of an association, which being regulated and being part of an association are two completely different things, right? So sometimes the same thing happens when we're doing interviews of somebody who maybe wants to come and work for the practice. And we'll say, well, who is your regulatory agency? Who are you regulated with? And they'll say, oh, I'm with, ABC association. We'll say, well, that's not a regulatory body. Because just quickly, the regulatory bodies are there to protect the public. So they are there to protect you. The associations are normally more to protect the practitioner, right? So the regulatory body kind of makes that separation between serving the professional versus serving the public, right? So there's a real important sort of distinction there, and a really important distinction for you when you're looking for a healthcare provider.
Mm-hmm.
So if you're wondering how to even know the difference, how to even tell, we're going to talk about that too. So, Anya, are you regulated?
Yes, I am a regulated naturopathic doctor here in Ontario, and the college that governs us and our licensing is called the College of Naturopathic Doctors of Ontario. And we, as naturopathic doctors, we're not required to be part of our provincial association like Richard had mentioned, but everyone does because we support our association because their job is to support us. But we are required to be members of the Canadian Association of Naturopathic Doctors.
Mm-hmm. So I'm also, it's similar to that. I'm also registered with the Ontario College of Social Work and Social Service Workers, the OCSW-SSW. The abbreviation does not make it shorter.
Yeah.
And then you can choose whether you are part of the OASW, the Ontario Association of Social Workers, or you can actually choose for the federal one for us as well, the Canadian Association of Social Workers. But most of us are because, again, they provide a lot of resources. I think this month there was 6 webinars for our association, lots of resources. So college is mandatory, association is not for us.
So, and I'm part of the CRPO. So basically the regulatory body for psychotherapists in Ontario. And the word that keeps popping up here is Ontario. Mm-hmm. So we talked about federal regulation, but also provincial regulation. So it's kind of the idea that, say, practitioners can travel between provinces and practice, but different provinces may also have different regulatory standards and things like that. So oftentimes, say, Anya, if you wanted, I suspect, to go practice in BC or something like that, you probably have to, say, write another exam or something like that just to make sure
transfer our license over, do a jurisprudence exam, and make sure we meet the requirements.
Which is also why then, say, for you, if you're looking for any kind of, say, healthcare services, if you're looking for a practitioner and say you're living in, say, BC and you say don't have an Ontario address or anything like that, you may not be able to get services from somebody in another province. Say, because for us, I don't know if it's a technical word, but I often have to hear poaching and things like that. That say you can't take people from other provinces, that you have to leave those for those other registered practitioners in those provinces.
For social work as well, it's because the provincial legislation is so different. Like in BC, for example, I actually just looked into this because the client was moving. They write different exams. You can write an exam to diagnose in BC. I cannot do that here in Ontario. So my license can't carry over because I can't go here where I'm not allowed to diagnose and then hop a province and diagnose. So it's because the laws are so different, child protection laws, because social workers work in a lot of different fields. So there's an added layer for us.
You guys don't just steal children? I don't know. I missed the last
As much as I would like to, and if you missed that episode where we talk about that, we'll link it below. But as much as that, I wish that was my job. No, sadly, surprisingly, don't just take people's kids away.
Ale jesteś czarownica. You're a witch doctor, right?
Yes.
Yeah,
I'm
I
a
was
witch
right about
doctor.
that one, right?
Yeah, totally. Cauldron and all.
So you're hearing about regulated versus not regulated. So we talked about what it is, why it's important. What do they do?
So, like Richard had mentioned in the beginning, our regulatory body do not protect us. Their job is to protect the public, and that's why we all have to write some sort of exams and licensing
Usually
requirements.
multiple.
Yeah, multiple. They're hard. They're very difficult. They're expensive. It's not cheap to be licensed, but this is how they create a standard and make sure that we're all providing safe services to the public.
So you can even, it's interesting you say we all have to be licensed. For future social workers, we were exempt. We didn't have a practice exam. We had a million other education requirements. That has now changed, and they are putting that in place even for us. But a lot of what the college does is it's a place for reporting too. So if you're a client and you've experienced something that doesn't seem right, you can go to their college and report it. And then there's investigations.
Well, and I think the big thing that you guys are tapping into is the idea that, say, regulatory bodies provide, say, standards and sanctions, right? So it's kind of like the idea that, say, regulatory bodies, and again, I'm talking more with the CRPO kind of hat on, but I assume it's the same for all of your colleges as well. It's kind of the idea of, say, protecting the public from, say, practitioners who are, say, conducting, say, malpractice, negligence, just utter, say, incompetence and things like that, and having the sanctions in place that say if a complaint is brought to the regulatory body, that the regulatory body will take actions in terms of, say, doing an investigation. Essentially, the regulatory bodies, not the associations, the regulatory bodies keep the practitioners accountable for their actions, essentially.
And even past their actions, it keeps them accountable to make sure that they still know what they're doing.
Yeah.
In all of our fields, things change all the time.
All the time.
And I know my college, and I know at least your college, and I'm assuming yours, we actually have to each year do a variation of reporting how much continuing education we've done to ensure that we're still engaging in best practices and we're not kind of just going free from 20 years ago if it doesn't work anymore.
We're keeping up with everything. We have to. That's how we stay licensed. And if people do get in trouble, I don't know about you guys, but there's a way to check that. We have a public register. So all of us have license numbers, and that's public information. And you can contact my college on the website. You just type in my name and my picture comes up. And then there's also statuses with someone's active, and if they're inactive, if they're under investigations, and if someone was in an investigation, that kind of comes up too, and if they did reconciliation for it and things like that. How about you guys?
I know for mine, so we don't have the picture, but if you go on the college's website, you can type in a name, the number, both, and it'll come up whether active and also in good standing, or if there's an investigation. Even if there was an investigation and it proves that it goes nowhere, that can still show up that it existed. And if you did do something, say I really messed up somehow, and there was found an issue, exactly, minimum of 3 years when you type my name, that complaint is tied to my name. So there's accountability even for if you've made a mistake in the past, it follows you with the college.
Well, for our college, it's the same thing. So, like you were saying, even if there was a complaint against you, they did the investigation, they found out that you're totally clear, you did everything right, it's still online. So another person can look you up, which I do suggest that people do look up their practitioners online. I know, like even you, Brianna, when we were, say, interviewing for, say, social workers here
It
at the
came
practice.
up.
Yeah, and it came up. There was a few people who said that they were registered, which they weren't.
Or even just, it's important to look it up, because even if I don't say registered, even if I say I'm Brianna Urquhart, social worker, if I'm not registered, I actually legally can't use that title. It's a protected title. Same as I think psychotherapist is a protected title. So always check. Just because someone says that they are, it doesn't mean that they are. And if their name or their number is not on that registry, then they are not registered with that body.
Well, and I think another important thing that, aside from, say, negligence, malpractice, and things like that, maybe this kind of falls into malpractice, but, when you were mentioning about, like, say, diagnoses in, say, BC and things like that, right? But you can't do it here. The other big thing that the regulatory bodies have, which is important, say, even, again, between provinces, like you were mentioning with BC, is your scope of practice, right? So we have a lot of, say, control acts. Well, actually, with psychotherapists, we have really one control act, which is basically... it's 5 sentences that basically say psychotherapists can only provide psychotherapy. But, it mentions things like, say, we can't puncture the skin unless it's an emergency, like, say, if you have an EpiPen or something like that. So if somebody, say, dying, we can't just sort of sit there and watch them. We actually have to do something if we're appropriately trained and all of that fun stuff. I know for you...
our scope of practice is
you have a little bit
probably a little larger, because we can puncture the skin. But again, that's through acupuncture, and we also... have that act under our scope of practice. And compared to BC, they have a larger scope. They're allowed to prescribe certain medications, and they're allowed to do more injections like Botox and fillers and stuff like that, which we actually can't do here. So again, that like jumping between provinces, everyone has different scopes of practice. But we do have an act in Canada that does allow our licenses to carry over. So I wouldn't have to do additional exams, so to say, because mine would be acknowledged over in BC if I were to make a switch.
You and Brianna, like aside from like BC for the weather, like it sounds like a lot funner to practice in BC for you guys.
Sounds definitely.
Exactly. And I think what's interesting, because you've mentioned there's different acts. So even though, yes, I'm regulated by a college, there's also different acts. I mentioned, like in the last video of this, the child protection laws that are separate. And if I were to practice in that field, I would have to follow those. The college is always, you have to practice not just ethically, but in and of certain acts, whether that be federal or provincial, which is important as well, because chances are if you are unregulated, you may not know that at all.
Yes.
You might not go digging into the legislation because it's dull and it's dry and nobody enjoys it.
Well, and I think the other important thing too, to recognize, especially again, if you are somebody seeking healthcare, right, is that, say, again, a lot of third-party payers, a lot of insurance companies will only cover registered healthcare practitioners.
Exactly.
There are some people who are not registered that some insurance providers will cover, but normally, unless you are registered, you will not get your treatment covered. And so you might get a really nasty surprise after you did a couple of sessions that say your insurance provider won't be covering your treatment.
Yeah.
So it sounds like so far benefits is accountability, there's ethics, there's, you know that if something goes wrong, you have someone that you can go to that can help you with it. Also education, background testing. If you're registered, you kind of know, and you've had the training, and you kind of, the assumption is that you kind of know what you're doing. So what are some of the concerns maybe if, say, if you seek out unregulated, and maybe an example of that would be, you see them a lot these days are the coaches that you see on social media, right? The coaches. So what would maybe be warning signs or concerns if you went that route as opposed to, say, a mental health professional?
So from like a naturopathic perspective, it's just 4 years compared to probably a weekend course is just not enough knowledge, and you can get seriously hurt. That's what I'd be very concerned about, like with natural products, and anything that you get off of a counter, there's dangers associated with anything and everything you take. There's interactions, and we are given the tools and have the knowledge to check those things, and we research all the time to see what are upper limits, because you're not going to tell someone to take a certain supplement every single hour, because that could seriously hurt them. So a lot of it is safety. We don't want to hurt our patients. We want to make you feel better, right? So
well, and I think even when you say, like, we want to make you guys feel better, right? I think it's kind of also the idea that, say, with all that education and everything like that, it's kind of like that good intentions pave the road to hell, where it's sort of like, somebody who's unregulated may also really want to benefit their client, right? But lacking some of that education, like you were saying, 4 years versus maybe like a weekend or something like that, I think is pretty significant. And again, that's not to say that, say, people who are registered, that we don't have our, our share pickings of like shit pumps. Like we have like some pretty lousy, therapists and things like that out there. However, it's just the regulatory body. You would suspect a lot of those people do eventually get weeded out. And if they've done something, it's going to, as you mentioned, Brianna, it's going to show up on their license, like on the regulatory website.
And I think it's important, not every coach or every unregulated, because some professions or some fields don't have a regulatory body, whether they should or not is a separate conversation. So it's not to say that every unregulated health professional is automatically bad or problematic, but it's really about doing your research. So say maybe there is a wellness coach for something. Look into, ask their educational background. Maybe they did the programs and graduated or are in progress, or maybe they have expertise, but really just doing your homework and making sure that anyone can call themselves a coach, or anyone can call themselves a word, as long as it's not, psychotherapist, social worker. There's a million other words we could probably use.
People get creative.
Really
they make up their own titles.
Yeah. Well, Brianna, I think, you and I especially know some investigations we've done of some people. And I think one alarm bell that kind of comes to mind for me when it comes to, say, finding a healthcare practitioner, the more titles the person has, sometimes that should be an alarm bell, because sort of like for me, I say, psychotherapist, and all of a sudden it's kind of like that kind of covers like a big breadth of things. But if I'm kind of like, faith doula, happy endings therapist, like all these sort of
wellness
titles,
guru.
Exactly. That should probably set alarm bells off, because I shouldn't probably need that many titles unless I've done like a dozen PhDs.
Sort of like when you see, and it's like, I specialize in, and it's as long as your arm. Like if they specialize in 10 areas, can you really even say you specialize at that point? Because that's a lot of knowledge. Exactly. So just really doing your homework and following up, right? If you say, see on Psychology Today or see somewhere, Psychology Today is actually great because they check. Yeah. They actually investigate and will see your number. But say somewhere else, say even on Google, someone recommends a therapist or a social worker. Check the name, run the name, ask questions to the professional about their background. Just because they say it doesn't mean that it's necessarily true.
Yeah. I think it's important to ask that question too, like say in the intake, right? Because oftentimes I think people come into an intake, like say as a patient, as a client, and they're expecting to get sort of all these questions, right? Like, I'll self-disclose that, Anya, you did an intake on me, and you asked a lot of invasive, judgy questions. So, and I feel judged using hot sauce or drinking coffee around you. But it's also an opportunity, I think, for you as a patient or a client to also ask that practitioner a lot of these questions as well, right? Because if you feel like, they're going to put you on the spot, so to speak, like you did to me, you want to start asking them questions as well, right? To sort of, again, see,
And that's a red flag. If you ask your professional questions and they get defensive or get their backs up, as long as they're appropriate questions, if they get their backs up, that's a red flag to me, because, if I should be comfortable telling you what I graduated in, what my license is, what my practice is. That's the whole point, right? I actually specifically leave time at the end for questions that they have. But if they don't, that maybe is a sign that to maybe look into that.
And I think free 15-minute discovery calls aren't utilized enough, because you don't have to invest money in that. It's 15 minutes out of your day. It's just a phone call, and you can ask kind of like preliminary questions and get a feel for the person, because sometimes you do need to shop around. Just because you meet with one person, like, you're not stuck with them for the rest of your life. You may not necessarily click, and that 15 minutes can sometimes make you feel a lot better moving forward with making that initial visit.
And I think even just because you see them doesn't mean you're stuck with them, vice versa. Just because maybe you and I don't click doesn't mean that naturopathic medicine is not for me in the history of the rest of my life. It just means that maybe we didn't click.
Might not be like a right now thing.
Timing's also important.
No, for sure. Like, and I think that's a huge point as well, that just because you don't click, right, doesn't mean you won't maybe click with another therapist, right? Because even I'll sometimes speak to my clients. Sometimes the first sort of session is, I'll like you, Brianna, like I'll leave like the last, say, 10 minutes, and I'll leave the last 10 minutes of every session to sort of have a little bit of a discussion, like, what were their perspectives on the session? How do they feel everything went? And any areas of, say, improvement for me, if they think I talk too much, I talk too slow, or whatever the case may be, or if they're like you and they think I drink too much coffee.
Coffee and colleagues.
That say, I'll tell them sometimes the first visit that say like, look, like, I'm happy you felt good and everything like that, but like, if you want to see like another therapist, if you felt like, shop around, because maybe I'm not the right fit for you, but somebody else would be. And I think that's one of the nice things about our practice here, is that we have, a lot of therapists here that sometimes say, I know sometimes people have jumped around from therapist to therapist here.
And I think that might be a good note to end on as well, is another perk of something regulated like this. If you're not a good fit for me, there's other options here. Or if you identify something with me that maybe is health related, there's other options. If a lot of times unregulated people work alone, and that could even be a whole other topic for another video. So I really hope you enjoyed episode 2 of Coffee and Colleagues. If you want to check out that playlist last week, or if you're watching this later, more episodes, we'll leave that there. Otherwise, don't forget to like if you enjoyed this video, and comment down below if you have questions that we didn't get to about what regulated versus unregulated means. And don't forget to subscribe and hit that bell button so you don't miss the upcoming Friday lives and other videos we have separate to Coffee and Colleagues. So we'll see you at the next one.